Good evening, everybody out there in social media land. I'm back with another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I am Nurse Charlene. And the topic tonight is kind of near and dear to my heart because it just talks to all of us or somebody in our family. And that is addiction, but I did it different a little bit and stuff because I've talked about substance use disorder and different things like that. But this time I'm talking about addiction when the body and the brain take control, meaning when everything turn up and you get lost in the shuffle, and everything. So I want you guys to come on in. I probably won't keep you more than a couple minutes after an hour and everything. 7 to 8. My target is about 8:15 if I get enough, interactions because I want to answer your questions where I can on board and everything. So yes, welcome on in. Check out that little board behind me, which look, I got my little pom pom today. I came up with a little prop. So that is, alcohol like beer or, some type of drink, wine cooler, whatever that is. And then the second one right there, that's just a big old supersized pill. It's just really those little small pills you take, but that's a little supersized one so you can see it good on the board. And then right here, I got my hypodermic needle in a little vial of something. It's never that pretty and stuff. It's usually a spoon and a little bit of liquid or something like that and some meth or something like that. And then they draw it up and then they pop it right into their arm and stuff. So it's serious what I'm talking about. And then right there, I try to look like the Newports or something because I know they were the most popular back in the day and probably still is today and stuff. But they're $15 a box. Yay! Yeah, so now you got to be rich in order to smoke and kill yourself. Yes. Okay. So that's that part and stuff. And then we got over here is just say no, or addiction, and stuff. And it's crossed out. It's a bottle of prescription medicine. And then you got your hypodermic needle at the top. And then over here, a glass of beverage of some type of adult drink and everything. And then you can't see it because the light is shining back because it's shining on me, but it's shining on the board too. But it's a NA for Narcotics Anonymous, AA for Alcoholic Anonymous, and then there's also rehab, or you could say I was in recovery or I was in rehab and stuff. They kind of interchange, but they mean almost the same thing, and stuff. And then over here in the corner and stuff is some of the drugs that people don't think is really addictive, but they are. They're to be abused and everything. And that would be your tobacco, your alcohol, your methamphetamine, meth, crystal meth, whatever you want to call it. What else is there? I don't see the last one. Maybe I'll write it in darker letters next time. But yes, that's there and stuff. So I take my time out. I usually study everything I'm talking about and stuff, and then I go right into telling you and stuff. So the first thing I'll do is I'll get on. I'm just trying to put somebody on real quick. Okay. And so the first thing I do is I get on here and stuff, and then but before I get on, I already read over what I've written down, where I took this piece from, that piece, and everything. Oh, and this is good, So now I'm coming up with other things like I'm gonna give you a lot of quotes and stuff, and they're quotes tailored to my brand, which is Your Body's a Snitch, Believe It, but also tailored to medical talk in layman's terms with Nurse Charlene and everything. But they're interchangeable in the fact that yes, Your Body's a Snitch, Believe It is my LLC, but medical talk in layman's terms is also my platform where I talk medical talk and everything. I'm not going out there claiming nothing extraordinary or anything bad and stuff. I'm trying to claim what's good, what you need and everything. And it's just kind of like a help to you, and stuff as you process what I'm saying. Yeah, as you process what I'm saying, then you understand why I'm putting this way and that way. One more thing about the medical talk in layman's terms. Layman means to keep it simple so that somebody that knows nothing about medical can still get some type of information out of this. And I don't just talk about drugs. I don't just talk about drinking. I don't just talk about mental health. I talk about your whole body. I talk about hygiene. I talk about your hygiene. I talk about the drugs, and I talk about all the different kinds and stuff. And I spin it several different ways. I talk about having empathy, being able to put yourself in somebody else's shoes so that you don't just strike down on them so hard. If you were able to see yourself in their shoes, and what are they supposed to do? Then you might not be so judgmental and stuff. But also, I talk about wellness and the what is that called, the screenings, annual pap smears or annual prostate exams for the men, pap smears for the women, mammograms. I talk about uh women's mental menopause, but I also talk about men's andropause, and stuff like that, which is the same thing as man's menopause and women's menopause, and stuff like that, and different things and stuff. And I try to just stay on that level with you and stuff, but all while giving you the good stuff. So before I get all the way into this and start really just going into my topic tonight and stuff, I'm going to do my podcast disclaimer. And that is, the podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. If you have questions about a medical condition, reach out to a qualified healthcare professional. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Guest views are their own and may not reflect the views of the host, that's me, or this podcast. The information shared is for general knowledge. Nothing special. I didn't look at your medical record and then come up with this. It's just for general knowledge. It should not be used for any legal or medical purposes. Always consult with a licensed professional who knows your medical history for a meaningful evaluation, or don't get it done at all. And stay informed, but always seek professional advice when it comes to your health. Talk to these doctors. They want to work. Some of them, most of them, and stuff. Talk to your doctor and stuff so you could get safe information. You don't have to be left to, I don't know if this works and so. Well, girl, I tried this and I tried the so and so diet, the Oprah diet, and all of that stuff, and I tried this, that, and the other and stuff, and yeah, and stuff. Okay, that doesn't mean, because what works for that person might not work for you. We need to get you your stuff that works personally for you. What that person is allergic to, you might not be, so you can have that, or they vice versa. So that's where all of this comes in at and everything, and it's really important. So now I'm gonna dive on in. Y'all come on in and stuff. Come on, support your girl and stuff, or I'm gonna get off and I ain't gonna come back on. No. But anyway, it's been a year. I'm gonna go ahead. Y'all gonna see me some more and everything and stuff. But the long story short is, I'm getting on here because I care. I actually generally just care. And I have a lot of knowledge, not just a little bit. And I just keep it to myself and everything because I don't gatekeep. But I'm saying, I have enough knowledge that it doesn't hurt me to let you know what I know or what I've been through, and everything and stuff. Because at the end of the day, how do you get to the other side if nobody's talking about this type of stuff? It's so much stuff you can watch. I found myself scrolling through social media, and I saw it was a farting commercial where this guy, he got this little sound and it make all these little funny fart sounds and stuff. And then he's walking by people and he's like twisting his little butt and shaking his little butt and stuff, or he farted in his phone and said, "That's what you get, grandma," and stuff. And I just cracked up. And it was the dumbest thing. I would never want to be around somebody that's just blowing you up, and stuff in a park or something like that and everything. But the whole point was, you could watch that, but what did it do for my mental health? What did it do for my educational health, and everything? Absolutely nothing. So, if you're coming on here and stuff, you can go to those things, and stuff. You might see something about butterflies. You might see something about cooking channel and everything and stuff. But at the end of the day, you gotta let a little bit in here and there, just let a little something in, because it does help. It actually does help, and it'll help you in the long run and everything. So now I'm done with my spiel, and I'm go ahead and get on into it. It's called addiction, when the body and the brain take control. And your body's the snitch, believe it says. Addiction is a chronic condition that affects the brain, body, behavior, and decision making. It happens when a person becomes dependent on a substance or behavior, even when it causes harm. Even when it causes harm, it's hurting you, but you still got to do it. I have to. I don't know how to get out of this. Okay, you see what I'm saying? Addiction. Addiction is not simply a lack of willpower. It is a medical condition involving brain chemistry. It's certain stuff in your brain that if it don't flow right, you're going to act a certain way. So it's involving brain chemistry, emotional coping, your feelings. Emotional is your feelings. I feel sad. I feel happy. I feel mad. I feel like I'm okay. Emotional coping and environmental factors. That's your surroundings. Okay. Addictions affect millions of people worldwide and can impact health, relationship, your finances, and mental well-being. Mental well-being means it's well, it's good. Now, mental illness means something is wrong. It's illing, and stuff like that. So it's a bad thing and stuff. So that's where this comes in at. So then, a catchy quote, because I want to give you these and stuff because they really say something. Your body whispers first. Addiction happens when we ignore the whispers until the body starts to scream. Wow. It whispers, hey, you probably shouldn't do that. You're over that and stuff. You shouldn't take that pill. And then next thing you know, you're addicted, and stuff, because now you're taking them and there's no pain for whatever you got the pills for. That's why the doctors act funny and they don't want to give you the medicine because they've been getting in trouble for it, and stuff like that. So that's where this comes in and everything. So, of course, I have to give you definitions, because if I don't give you some type of definitions, you won't, you could get lost, but I could get lost too. Addiction, a disease where a person cannot stop using a substance even though it causes harm. I said that already, but I'm saying it again. Dependence. I'm dependent on this, whatever it may be, whatever the substance is. I'm dependent on it. And it's when the body becomes used to a drug and needs it to function normally. Meaning now I got to take this drug because now I'm dependent on it to get me to normal and stuff. Meaning that you were normal at first, but now that you had this happen or that happened and you got these drugs and stuff, now you're taking them in order to feel normal. They will never allow you to feel normal. They will allow you to keep on taking me and find ways to get some more of me and find some more ways to get some more of me. but they will never do what you really want them to do, which is originally what they were planned for. It was for surgery, or you broke ankle, or you broke your wrist or something like that, and they gave you some pain medicine and stuff. If you take it past that and your wrist is already healed or your ankle's already healed and you're still taking them, that's a problem and everything, because now you're taking them to get high. Tolerance, this is a big one. you know the biggest one, like in the hospital and stuff, as a nurse and everything, our biggest or highest tolerant patients were usually our sickle cell patients. So now you get the stigma of being black, and then you get the stigma of it's a genetic black disease. It affects African Americans and stuff like that. So then tolerance, they can tolerate a high amount because they've been doing this since very young, getting this high amount of pain medicine. Because it would take me too much to explain sickle cell, but what I'm saying is, when we get a sickle cell patient, everybody kind of tends to look like, what do I got to give them? Even me, and stuff. Look at the medicine and stuff, like, what am I supposed to be giving them? Oh, I'm supposed to be giving them this every 2 hours, because I know for a fact, if I don't walk in 2 hours, no matter what I'm doing and stuff, to that one particular patient, even though I got other patients, I need to make sure that they good and stuff, because they gonna make sure that I'm bad if I don't make sure that they're good and stuff. So that's where that comes in at. So a high pain tolerance or something like that is usually it. And so the tolerance is when a person needs more of a substance to feel the same effect. That means they need a little bit more, because 1 milligram is not doing it no more. 2 milligrams is not cutting it no more. 4 milligrams ain't even touching it yet, anymore. It touched it at one time and stuff. Now now we got 5. We got 8 milligrams and stuff. So 8 milligrams will probably kill a small horse or something like that. But these people are able to take this in because of their condition and their pain, and their tolerance to pain is, almost bordering on inappropriate. So when they're at home, I could just imagine them. They got to go find the weed. They got to go find a drink. They got to go pop some pills with some alcohol, because they need to be high to kind of erase that pain that they're having and stuff like that. So it's just really weird and everything. So that's tolerance. Withdrawal. So this is like, when you're coming on withdrawal from a substance, that means that you're trying to stop that substance, and stuff. It's no longer helping you, but it's definitely harming you and everything. And withdrawal is the uncomfortable symptoms that happen when someone stops using that certain substance. And withdrawal can be a lot of different substances. We'll talk about them tonight. Okay, so then substance use disorder. Now, I did a topic of substance use disorder or substance abuse and everything and stuff. And that's what this is. And that's the medical diagnosis for addiction to drugs or alcohol. Okay. And then another one is craving, an intense urge or desire to use a substance. That means you're craving it, like, oh, I like chocolate cake. Well, we're talking about substances, but I'm saying I like chocolate cake and stuff. I'm craving it. I got to get it. I got to get it. I got to get, or I got to get that cheesecake, or I got to get that apple pie, or whatever it might be and stuff. You craving it, and it won't stop until you actually go to that store and pick up that thing. So the same thing with drugs or alcohol and stuff. You're craving it. So you're past just drinking it socially for now and stuff. You're craving it. So it's a different effect on you and stuff. It's definitely something to think about and stuff. But craving is actually a thing and stuff. So again, we're talking about addiction, and when the body and the brain take control. Excuse me. And that it says, how does addiction work in the brain? So that's what I'm going to explain to you now. Addictive substances stimulate the brain's reward system. The brain has a reward, like oh, I'm happy system. I get this, and everything, releasing this thing called dopamine. So this is addiction 101. So dopamine is the brain chemical responsible for pleasure and motivation. It makes you happy. It makes you feel good. It's a wonderful thing. Yes, until we start doing stuff to keep on making the dopamine and are replacing it. Welcome on in, Auntie Josie. Thank you for coming on, my dear. She said, "Hello, everyone. Hope all is well." Yes, and I hope all is well with you. I did call you and leave a message. I hope you got it and stuff, because I want to ask you about that. You called me the other day and stuff, but it's okay. We'll talk again after the live is over. Yes, but welcome on in, my dear. And I'm talking about addiction. And so I just got finished talking about a chemical called dopamine, which is a chemical in your brain called dopamine, and it's responsible for pleasure and motivation. It makes you feel good. It makes you happy, and stuff. And it does good things for you when it's your natural dopamine. When there's a problem, I'll tell you that. Over time on the brain, it produces your brain produces less dopamine naturally. You need the drug to feel the normal or to feel good again. And it loses control over your addiction. The dopamine, you end up losing control over your brain and stuff because you just want what you want. I gotta get it. I know I'm stopping like because I want to just hammer it in there and stuff. It's you want what you want, and if you got an urge for it, you got to get it. I gotta get that chocolate cake. I gotta get that fentanyl pill. I gotta get that Molly, that whatever it might be and stuff. I gotta get it. Welcome on in, Rosie Granny Allen. She says she's watching in Jesus' name. Amen. That's right. This is why addiction becomes both a brain disease and a behavioral problem because it'll cause you to act different. Your personality will change, your brain waves will change, all these different things and stuff. And it's stressful. It puts even more stress on you. You might already have been stressed and having not so good life and stuff, and then this adds to it, but not in a good way. Everybody thinks it numbs them, but it doesn't numb you. It fools you into thinking it's numbing you, but it's not numbing you and everything. So I want to go into the top 5 most commonly abused substances. We're talking about addiction tonight, you guys. And so one, it's alcohol. That's number 1 on our top 5 in the US, pretty much, and everything. And so guess what it says about alcohol? Alcohol is the most socially accepted addictive substance. The most socially, it's just my little drink. I got my little drink. I got my little hen. I got my little this and that, and everything and stuff. That's what it is. Until it's not. And you got to have it every day. And you can't really afford it because it costs so much, for the good brand. So you try to drink whatever brand you could get a hold to and everything and stuff. But that's alcohol. Excess use can lead to alcohol use disorder. That means drinking over. I'm drinking to get drunk. I'm drinking to not remember nothing. I like it. I like throwing up in the morning and stuff and throwing up all day. And then as soon as I'm finished and my stomach feels better, I'm going right back and I'm drinking again and stuff. You're addicted. Okay. The risk that alcohol causes to your body. Liver damage. Liver is your blood filter, and stuff. It filters blood through it and in order to give you good blood and stuff. And then it releases the dirty stuff out of the blood. Also, heart disease. That means, heart disease means anything. High blood pressure. It means coronary artery disease, all these different things and stuff. It means a lot of different things and stuff. And that's just heart disease, liver damage. Thank you, Rosie Granny Allen says, say that. That's right. And stuff. Another thing that it releases, it damages your brain. So you put yourself at a risk for brain damage. And guess what? If you can't think properly and normally, you in trouble, and stuff. I'm in trouble, you in trouble, we in trouble, and everything. And then also it puts you at risk for accidents, car accidents. You drinking and drive. I wasn't even that high. I only had a couple drinks. They was 16 ounces though. Yeah, you had a bottle full of whatever it was and stuff. So yes, it's a problem and stuff. And then it causes depression, and even suicidal type ideations, or suicidal things. You want to kill yourself. You miserable. You sad. You're emotional and all of that stuff. Now, symptoms of addiction from alcohol. You got to drink daily. That's one symptom. Every day I got to have me a drink. Every day I'm hustling for my drink and stuff. Number two, unable to stop drinking. I can't stop. You know how I be feeling? You know how stressed out I am? I need this. I need this. Well, whatever works, whatever floats your boat. But just remember, you saying you need this, and that's the addiction speaking. Not you speaking normally. That's the addiction speaking. Because you're trying to make somebody understand why you're drinking when you didn't drink all your life, or something like that. And then blackouts. Oh yeah, it was fun. I don't even remember what happened and stuff, but it was we was live, we was turned up. Yeah. So somebody could be, beating the heck out of you or something like that, or they could be doing yucky things to you and stuff like that. You could be raped, anything, man or woman, and stuff. You could be taken advantage of and everything. You're in a blackout. You don't know what's happening to you. What if you black out behind the wheel? Then you don't even know, and you die in the car, and you can't even wake up because you didn't already blacked out and stuff. So you didn't already crashed into that 18-wheeler or something like that and stuff. So it's literally that dangerous and everything. Irritable and mad when you're not drinking. Yeah, so I gotta come talk to y'all and deal with all of this stuff. And I'm mad because I want to drink, and whatever and stuff, and however that looks, and everything. So that was alcohol and stuff. So the treatment, and then I'm going on to the next one. The treatment is detox. Detoxification is the long word for it, but that's trying to kick the habit or something. That I'm trying to think of the easiest way to say this, but detox. It's cleaning your body, your system of this alcohol, because we're talking about alcohol right now. Counseling. Yes, not just church. Some people, they're able to, pray and talk to maybe a clergy man or woman, and stuff like that. And that's good. That's good. Never said nothing bad about it and stuff, because that's what I would do, and everything. You see the little crosses on my shirt and stuff. That's me. But I'm not telling you that. I'm telling you, you got to go to the God of your understanding, or the spiritual leader, or the head of your household. I have one of my household. You have one of yours and stuff. It's not necessarily, you don't have to be like me and stuff. I know that we're not the same, because there's only one of me. It's only one of you. But what I'm saying is it's okay to go to counseling. And stuff. That's why they have drug and alcohol counselors and different things like that, sponsees and, sponsors and stuff like that. And that whole situation and stuff. And it's important. Also, what did I want to say? Support groups. And that would be like your Alcoholics Anonymous and different peer groups like that, where everybody has the same common thing that they're going through. And they're there and they talk about it, and it helps other people feel better and everything and stuff. Welcome on in, Sandra. You said, sorry for me being late, but I'm here now. Yes, you're right on time. I just did the first one. I'm talking about addiction. and I just covered alcohol and stuff. So you'll be able to catch the replay. And she said, "Good evening, Nurse Charlene and Rosie and Britt and everyone else. Trouble with my phone. Oh, and T is not there. Okay, it's all right and stuff. You tell her to get back on later and stuff, and so she could catch the replay and everything. But thank you for joining and stuff. I appreciate you and stuff. So that was a support group, and then they have medicines that you can take for alcohol addiction and stuff. One is like some type of anti-abuse or something like that, but it's also naltrexone is one, and it's another one. I can't think of it right away and stuff, but it's a different one. I'll put it inside the comments after the live is over and stuff. But they're very important, and there is a way to actually recover from alcohol or and so on and such. I'm gonna give you the 5 most common and everything. So guess what? Your liver keeps the receipts for every drink. Ooh, that's cold. Your liver keeps the receipts for every drink. Ain't that powerful? Like that's some real stuff. The liver, your liver, everybody got a liver and stuff, and it keeps receipts. Like, oh, you drinking? Oh, you gonna damage me? Oh, you gonna damage me? Oh, yeah, you gonna have to pay for that, and stuff. Whether I gotta turn up, okay, you could turn up, but I'm gonna let you know and stuff. I'm about to start doing some stuff. You ain't gonna be able to turn up too much longer, because I'm gonna inflame myself and everything. You gonna find out I'm here and stuff. Thank you, Sandra. She said thank you. And Rosie said all 5 are heavy. Teach, nurse, teach. Thank you, Ma. I love that woman. I love my mommy and stuff. She is just the sweetest thing and stuff. And I so appreciate you, Rosie, and everything and stuff. Welcome on in, Nurse Mary. She said, hello, Charlene. Great class. Love your board. Oh, somebody love my little writing. It's a little cartoonish, but it's getting to the point. It's keeping it in layman's terms and stuff. Yes, thank you, Mary. Y'all welcome on in. Come on, let's get started. So I just talked about addiction. Now I just went over alcohol and everything. Now I'm going to number 2 on the top addictive substances to abuse, and everything. And that will be your opioids. What is an opioid? I don't know. No, I'm just playing and stuff. Opioids are powerful pain medications. I broke this, or I had surgery on this, and guess what they give you? They give you little special spicy little pills, huh? Yes, they give you Percocets, they give you some what is the old trams, they give you what is it, morphine pills, they got oxycodone, oxycontin, MS Contin, what else is there? They give you everything, a little bit of everything, and then some more. Thank you, Mary. So examples include, oh, I was just saying them, but examples include of opioids, oxycodone. That's your oxys, yeah, until you get addicted. But anyway, morphine. Oh, I like morphine. Oh, do you? I like morphine too, but not if I'm not hurting. Yeah. Fentanyl. Well, we know it's a place called San Francisco. Oh, yes. Oh, see, that's what I need, Mary. Thank you so much. She said Tiger Woods having an addiction after all of his multiple surgery. Yes. So Tiger Woods, that man is rich. He papered out, or he was, or once upon a time. But I'm sure he's still living right, and stuff. But he also, even though he's rich and a celebrity and all of that stuff, that don't stop you from getting addicted. We seen Lil Wayne used to he he a little special, because of certain drugs, and stuff, leaning on them lean and all of that type of stuff. And that's what I'm saying, and stuff. So it's all these different things that can get you caught up. So one was alcohol. Oh, but you gonna go to a party, you're not gonna drink, you're not gonna have no wine or nothing. Yeah, I can have some wine. Do I need the whole bottle and then start drinking out of my friends' the glasses too? Or going over to the bar, you can't catch me away from the bar. I can't even dance at the party because I'm at the bar. You see what I'm saying? So no, this is serious and everything. So the same thing with opioids, which are powerful pain medications. They're there to help you with pain. Now, what happens after the pain is gone and the surgery is healed up and you still on there like you just had the surgery yesterday? That's probably a problem. And just check yourself and everything. So also, so I said oxycodone are examples of powerful pain medications. Morphine, fentanyl, heroin, dilaudid, hydrocodone, and all these other ones and stuff. Those are all prescription pain medicines and everything. I think not the heroin, but they put that down there. So, okay, whatever and stuff. So the risk of opioids, the risk to your body is extreme addiction potential. Yeah. Taking it after the pain is gone and the surgery is healed up or whatever is going on that you got it for. The bone has fused back together and you no longer have a broken bone, but you had them pain medicine. Leave them bad boys where they lie. Because do you want to invite some more stress into your life? I'm prime example of sitting up here holding on to a medicine and stuff, and everything. Now, all I had to do in order for me to become addicted and ruin my life and stuff is to go ahead and start taking them, and I don't have that pain that they gave me that pain medicine for. Then it's their problem. Welcome to hell. Welcome to hell. Okay, and stuff. So the risk that you put yourself at for abusing painkillers, extreme addiction potential, respiratory depression. What that means is respiratory is you breathe it in and out. Depression means, instead of you breathing like just naturally while I'm talking, I'm breathing. Guess what happens when you're on those painkillers and stuff? They stop you or slow your breathing down to an unnatural. When you're breathing, you're not just breathing just to okay, and stuff like that. You're breathing to release poisons out, like your kidneys, and stuff like that. When you pee, that's the trash of your kidney or urinary system. When you poop, that's the trash of your gastrointestinal system. That's food and stuff. After it processes, it comes out in poop. So that's the trash of your gastrointestinal system. Pee is the trash of your urinary system and genital urinary system. And so everything is for a reason and stuff. So when I'm saying that, I'm saying that all these stress. So when you're breathing and stuff, it's that breathing out, that's carbon dioxide. You don't want that to stay in. So if you're breathing normally, you could breathe in that clean air and stuff. But guess what? Some dirty air got to come out, or the trash of your lungs has to come out. It's carbon dioxide. If you're breathing shallow because you're on drugs and stuff, so you're barely breathing, barely getting it out and stuff, guess what you're doing? You're leaving that in there, and after a while, it stays in there and it starts messing things up, especially in your brain and stuff. So you don't want that to stay inside of you. You want to be able to push that trash out. Peeing, pushing the trash out. Pooping, pushing the trash out, and so on and so forth. So that's what that's all about and stuff. That's what I was trying to get to and everything, because I'm trying to keep it as simple as possible. But it starts making sense after a while and stuff. So then the symptoms that you are addicted to opioids: extreme drowsiness. That's what you're going to catch. If I'm sleepy, I don't have to worry about stress. My PG&E is cut off, but I don't have to worry about the stress no more, right? Okay. Constricted pupils. That means they're You know, that dot in your eye. Remember, I did a eye one, but I'm gonna have to do another one and stuff. That's just a tunnel in your eye. It's not an actual little dot on top of your eyeball and stuff. That's a tunnel into, you know, where your eye receives light and it bounces to the back of your eye and reflects certain things so that you see color and all of that stuff. It's a big old deal and stuff. So I ain't gonna go that far. But what I'm trying to say is constricted pupils. That means, and your pupils might be big, you know, you got brown eyes or something like that. And then you got a dot in the inside and stuff. And that dot, it gets so little, like, you know, like the tip of a pen or something like that and stuff. It's so little as opposed to being a big old giant black dot in there and stuff like that. And so that's what a constricted pupil is. And then also you got slowed breathing. And I told you that if you breathe out slow, you're not pushing out that trash of your lungs and everything. So that's a problem and stuff. If you breathe regular, you're breathing in, you're pushing it out, you're healthy, you feel good, you're not sleepy or drowsy, everything is okay. But if you're not pushing out enough of that trash that's in your lungs when it wants to push out through a breath and stuff, you're messing yourself up and stuff. So that's what that is. And then drug seeking behavior. You always on what I think they used to call it back in the days, they called it being on the mission, you know, and stuff. The mission is you looking for more drugs. How do I get them? What do I need to do to make it happen? You know, and stuff like that. So that's where that comes in. And the treatment for opioid addiction is medication assisted treatment such as methadone. And it's another one, I can't pronounce it. Buprenorphine. Buprenorphine and stuff. It's really a thing and stuff. I'll put it in the comments and stuff. I can't pronounce everything and I'm not going to try and everything, but there's certain things and stuff, like especially the methadone. That's the one I've seen the most, you know, as a hospital nurse and stuff, doing that and stuff. And I used to hate when I had to give them, they had a prescription for 180 milligrams of methadone. And the pharmacy, for some reason, only had 10 milligrams. So, you know, you mean to tell me I got to pop open 18 of them little pills and stuff. And then they be like, and give me some orange juice. And this is going to dilute into the orange juice. And then I just drink it straight down. And I'm like, yeah, because it's never happened to me and stuff. But I get it now. And stuff. Rosie Granny Ellis said, yep, teach. That's right. No, it's serious. It's serious. You know, I say certain things and stuff like that, but definitely I wouldn't do this unless it was something that was 911 worthy and everything. So another one of my catchy quotes: when breathing slows, the body is sounding the alarm. When you slow down and stuff. One example, because my mom, for one, you know, is like one of my best clients, you know, and stuff and everything. She's in there. She just had a 6.5 hour surgery, you know, to remove a tumor from her body and everything and stuff. So long story short, they had her on different types of medication because when they removed that, they removed other things and stuff. So now they don't want her to be in pain. They should have did something else, because what they did was they prescribed medications that my mother's not used to. So it was called being opioid, because we talking about opioids, and opioid naive, meaning she's a virgin to some of these medications. So one of the medications that they gave her in recovery was fentanyl. And as soon as she heard they was gonna give her fentanyl, she was like, "Oh, I don't want that," you know, and stuff beforehand. But I was like, I never even thought about that. I was like, Rosie, you gonna be good, you know, you gonna be sleep. Yeah, guess what it did? It slowed her breathing all the way down. Your normal breathing, you could be from, I want to say, 14 at the lowest. You know, 14 is kind of pushing it, but 14 to 20, you know, 21, 22 or something like that. Respirations, you know, and stuff like that. My mother dropped down from regular respirations because she had got so much of that fentanyl and I think dilated, and she had an epidural and all of this stuff for her surgery for, cancer and stuff, that they gave her all these different ones and the little push button and all of that stuff. And she damn near stopped breathing. Her blood pressure dropped, just tanked 70 over 30, and her respirations were 7. She on her way out. She on the stairways to heaven. You see what I'm saying? How serious this is and stuff like that. So the moral of that story is, yes, they had to do this stuff called, just put it up, Narcan. They put her on a Narcan drip because they gave her some. She woke up like, ooh, oh, I'm here, and stuff like that. But guess what? She fell back to sleep. And she kept doing it. And she kept slowing down to almost not breathing again and stuff. So they had to put a drip up of Narcan, which reverses the opioids, or supposed to. But why she had to have a drip? Because she had so much in her system, her body was not clearing it fast enough. And she was naive, meaning a virgin to fentanyl and stuff like that. So it wasn't a good thing for her and stuff. So the moral of the story is, you got to watch out. All pain medicine ain't good medicine, even when it's in an emergency situation and stuff, because that was serious. So going on to my next one, which is nicotine, tobacco, that and stuff. Nicotine is one of the most addictive substances known, found in cigarettes, cigars, and vaping products. Yeah, you're not getting away with it because you got a vapor, and stuff like that. Yeah, you still smoking cigarettes and stuff. Well, they got vape pens for weed and all of that stuff, but you still smoking, and stuff at the end of the day, and come out and smoke and stuff. So the risk for nicotine is lung disease, heart disease, stroke, and cancer. Really? Yes, really. Okay. One major disease linked to smoking is chronic obstructive pulmonary disease. Yep, I'm not going to break all of that down. It's called COPD, chronic obstructive pulmonary disease and stuff. And it's one of the main ones from smoking is that one. And what it's meaning is it's obstructing you from breathing correctly. It's not allowing you to get all that good air in and then push all that good air, that bad air or that trash out, and everything and stuff. It's messing up the system. And guess what? No breathing, you become unalive. No breathing, like no heartbeat, you become unalive. No breathing, you become unalive. Either way, you can figure it out and stuff, but that's what happens and everything. So symptoms that you're addicted to cigarettes, vaping, or any other cigars or whatever else and stuff, because some people think it's cool to have a cigar. Well, maybe once every 6 months on your birthday or something like that. But if you having a cigar every single day, I can't do without. I can't do without this. I can't do without my pack of cigarettes. I'm not here to judge. I'm here to tell you what happens to you. You can keep on doing what you got to do, but just know that this can happen to you and everything. So symptoms that you are probably addicted: irritable without smoking. You can't seem to be calm. You kind of mean and ready to knock the heck out of whoever. Nothing's funny. Everything is you trying to irritate me, and stuff. You're argumentative, and stuff like that. That's one. Another one is the strong craving to smoke. I gotta go smoke. I don't care. I'm going. They $15 a pack. I'm getting 3 packs because I ain't gonna be without my cigarettes and stuff for none of y'all, or whatever it is, and stuff. And then another symptom that you might be addicted to cigarettes or nicotine or whatever it might be and stuff is smoking shortly after waking. As soon as I wake up, I got to have my morning smoke. And then I got to have another smoke after breakfast. And then I got to have another smoke in the car on the way to work. And before I go into work, I'm going to smoke one more time. Yeah. Yes, Sandra. Thank you. Congratulations, she said. I'm 5 months clean from smoking cigarettes. Yes, yes. Pat your back, and I'll pat your back when I see you and stuff. That's very good and stuff. See, it's not about the judgment. It's about what can happen to you if you don't listen to something like this and stuff, or see something like this and stuff, because it's very important and everything. And you just added time to your life, to the end of your life, like a car note, you paying that car note and stuff, and you miss one because of some hard times, you missed the car note, and they slap that on the bottom, the back of your loan or whatever and stuff. And now instead of this many months and stuff, it's 37 months or 38 months or something like that and stuff. That's what that is and stuff. So you just added some time back to your life where you probably could have went, sooner, but now you're not and stuff. So that's a good thing and stuff. And you should be happy about that. And congratulations. I salute you. Yes, yes, ma'am. And stuff. So the treatment for nicotine, and stuff. Aside from being a miracle worker and going cold turkey, sometimes people can't do that and stuff. It depends on how much skin in the game they got, on it and stuff, because that's the other thing, especially if you're not always doing it and stuff like that. But somebody that's really, really heavy, it's going to take a little bit more time, and stuff like that. Somebody that's, I got to do this for my life. I need to save my life, and other things are happening to me. So I need to fix me or I won't be here and stuff. And sometimes that'll get you off a lot faster and everything. So the treatments are nicotine replacement therapy, like Nicorette gum. They got patches, nicotine patches, and different things like that. And they help you wean yourself off, because sometimes you got to take baby steps. Sometimes you could take one big step, but something might have happened mentally that made you say, I got to stop now. I'm going to die, or something like that. But other people, it might take a little bit longer, whether you die or not and stuff. So they might need that patch. And then they got strong ones. And then they wean you down to a lower amount and stuff. Then you got to change your behavior and all of that stuff. So the next one is behavioral counseling. Yeah. They used to have a patio for everybody back in the days. You could see them, Archie Bunker and them smoking and stuff like that in the house and everything and stuff. And so at work, they used to have a patio, or you could go outside out this back door and everybody be in the alleyway smoking or something like that. Well, they shut all of that down, but that doesn't mean people gonna stop smoking. They made the cigarettes $15 a pack and stuff, but that don't mean people gonna stop smoking, and stuff like that. But you got to change your behavior, change your surroundings, find something else to fill that space that you used to go out there and do that, or go out to my car and smoke real quick and then come back in, and so on and so forth. Because you'll be surprised how much you go through just to get that smoke. You're already stressed out you might have to smoke 2 cigarettes by the time you find the place that you need to find to smoke the cigarette. It's that bad and everything. And then there's prescription medicines, and that, like I said, the Nicorette gums, and they got a lot of different medicines and stuff like that. But there is help and stuff. So it's not just on you by yourself. It's on you and a healthcare professional that can help you get through this, or a family member or something like that that's been through it or something like that. They're usually good help too. But you got to see the fruit under the tree. They had to have been smoking, and then they stopped and stuff. And so that's the same thing with you and everything. So then another thing, this is a big one for smokers, or used to be smokers, whatever and stuff. If climbing stairs feels like climbing a mountain, your lungs are telling you something. It's snitching. Your lungs are snitching. If climbing stairs feels like you're climbing a big, tall Mount Everest mountain, that's the problem, and stuff. So what we gonna do and stuff. So that's that one. So one more, well, 1 or 2 more and stuff, which is cocaine. That's another addictive property and stuff. So cocaine is a stimulant that increases energy and alertness. The risk of doing cocaine, a heart attack, a stroke, severe anxiety, that's that anxiousness, that it's almost like a fear, and stuff. And nothing is really all the way happening and stuff, but you get more anxious than anybody. So you want to use more drugs to kind of calm that down. And addiction and stuff. So the risk of using cocaine is heart attack, stroke, severe anxiety, and addiction. Symptoms that you might be addicted to cocaine, crack, whatever and stuff is hyperactivity. That's a symptom, a hallmark symptom. Increased heart rate, your heart is beating out of your chest all the time. Dilated pupils, that means the little black dot in your eye is not constricted. Now it's big. It's big as the brown, or blue or whatever your eyes are, and stuff like that. And paranoia and stuff. That's a classic sign that you might be addicted to cocaine and stuff. Treatment for cocaine. Well, one is going to be behavior therapy. We got to change your ways. You can't be out on a mission hunting for drugs, first of all. Second is inpatient rehabilitation. It's different from if you had rehabilitation because you had a surgery or something like that. This is inpatient rehabilitation. This is recovery. This is rehab, drug rehab facility and stuff. And that's where that comes from. And then long-term counseling, because you're going to always need somebody to lean on and stuff. Yes, definitely. I always say prayer. You see my shirt and stuff. I'm saying that's what I do and stuff. It's the God of your understanding. It's the spiritual advisor of your understanding and everything. But some people, it doesn't hurt to use both, because you got to hit it with all you got, because it's trying to hit you with all they got, and they got tricks to make you think that you need it and stuff like that. So it'll do that to you and stuff. So just paying attention to that. And then it says, when the heart races like it's running from danger, the body is trying to escape the drug. That one's cool. When the heart races like it's running from danger, the body is trying to escape the drug. I don't want no cocaine. But anyway, that's what it does. So number 5 and the last one, as far as the top addictive substances: methamphetamine, meth, crystal, meth. Methamphetamine is a powerful stimulant affecting the central nervous. Oh, it's messing with all my spine and my brain, Craig. Yeah, it's getting all that and messing it all up. So it's affecting the central nervous system, and the risk that it poses: brain damage, severe dental decay, meaning meth mouth and stuff. They missing. They just start marching on. They just go to heaven. All them teeth, top, bottom, sides, back, front, whatever and stuff. They gone and stuff. And it's called meth mouth because it's doing all types of stuff. Not only is it doing the other things like addicting you, but it's also decaying your mouth at a rapid pace, jacking them gums up. Now you can't even eat, or when you go to bite you some chicken or something like that, your tooth come out with it, and stuff. It's just nothing there and stuff. It's real bad. And it's called meth mouth. You get skin sores. That's when they picking in their face and they got like 1,000 sores. Not acne. That's a different thing, and that's a different topic I'm gonna be talking on and stuff. I'm talking about they picking at stuff that's not there, and then they got all these polka dots all over their face and sores all over their face, all over their arms, all over their neck. You could just see it, little puncture marks and skin popping and all of that stuff and everything. You'll know what it is. And then psychosis. It's gone. It's gone. Mentally, just gone. Symptoms that you're addicted to meth: extreme weight loss, not like a cancer, not like a gastric bypass surgery or something like that and stuff. This is a totally different thing, but weight loss, extreme weight loss and stuff. And that they've been on drugs as opposed to they got sick from an illness or something. Aggression, and stuff, just kind of hostile a little bit. Hallucinations. They see stuff that you don't see, and they sit there laughing and talking to it, and you like, what the? But anyway, and stuff. Severe insomnia. They up all night and it's called high beams. Them high beams and stuff. That's what that would be happening. And then treatment for it, behavioral therapy. We got to change the behavior. You can't go out and you can't walk down that street. You can't go to this spot. You know, if you're on the spot, you might as well just do what the spot got, you know, and stuff like that. So, you know, you got to change your surroundings and stuff, change your behavior, how you eat, how you sleep, get some sleep, you know, and stuff like that. Also, intensive rehabilitation. That means you might have to go in and do a little stint, not in prison, because it's really nice at these detox and rehab facilities and stuff. They're really nice. They give you a nice clean bed. You're washing yourself and showering, doing self-care. Then you go to meetings, and then you do some more self-care, and then you do meetings, and you find other things to do with your life besides search for drugs, you know, and stuff like that. And then there's that long-term support. That would be always having a counselor and stuff, because you never know when you could fall off the bandwagon. You could go 30 years and then boom, you back out there because something happened very stressful in your life and stuff. And that's pretty bad and everything. So this is the other one. When sleep disappears and the mind starts racing, your brain is begging for help. Help me, help. She's on math. Nurse is on math. No, Charlene ain't on math. But I'm just saying, you know, and stuff, it's there. So when sleep disappears and the mind starts racing, your brain is begging for help. I need help. And it's going to do a few things and stuff. If you're not inclined to pay attention, or you don't have a family member that's still watching out for you or something like that, yeah, you're going to be in trouble and you might not be here long and stuff. It's that bad. So some of the root causes of, I'm just going to run through it real quick. Root causes of addiction. Biologically, it's in your genes, in your family genes, your DNA. It's in the brain chemistry, and that's biologically, and it's a mental illness and stuff. So biological, those are the factors that make you at high risk for addiction. Psychological, that's like your mental health or illness and stuff, is these factors are causes of addiction. Trauma that you just can't deal with, something really horrible happened in your, you know, in your life, you know, a rape or, you know, a loss of a child or anything and stuff that can throw you into addiction because you can't properly process that, you know, and stuff, which this could happen to any one of us. That's why I'm saying this and everything and stuff. So the trauma, and then stress. That means you're not effectively coping with normal stress and day-to-day stress, or it's too much for you and you got too much on your plate and you start flipping out and stuff. Now you need a drug or something to help you kind of numb this because you can't deal with it anymore. You have a mental break and stuff. And then depression can cause you to be addicted and stuff, psychologically and stuff. And that's feeling of sadness, you know, of not wanting to be here anymore and things like that. And then anxiety, you just on edge, you know, and stuff. And it's pretty bad. And then the social. So it's biological factors, it's psychological factors, and then it's social factors. And that's peer pressure. Watch out for our kids, even in elementary school. They still bring weed or a blunt or something. They parents blunts or whatever to school in the bathroom and stuff like that. So peer pressure. Adults, yeah, you can have a little bit of peer pressure, but you know how to, if you don't want to, you don't want to, you know, and stuff. A kid, I want to fit in, you know, and stuff like that. I want to fit in, mom. Yeah, no, that ain't how you fit in. Fit in with me and Jesus and stuff. I don't want you to fit into that, but that's where that comes in at. And then there's poverty. Not having enough food and stuff. Then the kid starts becoming an adult, and adult gets real deeper into their mental health and stuff. And the kid is trying to pay the bills. The kid is on the phone, you know, and stuff with the PG&E people and stuff because they parent don't want to talk and face reality and stuff like that. And so they kind of switch roles and stuff. And I'm talking about somebody that ain't even went through puberty. It could be a 5-6-year-old or something like that. And then easy access to drugs, especially in the kids' locker rooms and, different things, bathrooms, girl and boys bathrooms and stuff like that. They be having that, and stuff. And then there's a family history of substance abuse. Whose family ain't been through substance abuse? Because I need to know, was you born here or where you was born in the mountains somewhere or away from everybody? Because I don't know and everything. Yes, welcome on in, Sonia. She said economics can be a factor. Absolutely, poverty. And where you see the kid is dragging a parent along, the parent had already checked all the way out of life and stuff, and the parent is dragging the kid along and stuff, and the kid is dragging a parent along, and then the kid is like speaking up for him, especially in like when there's bilingual and the kid can speak the English and stuff, and so they're already handling most business because the parent can only speak for example Spanish. No pun intended to the Spanish Latino community, but if you speak only Spanish out here, and stuff, then your kid almost has to be the go-between, and stuff, so that the parent can understand what's happening. And they might not even know exactly what's happening because, like I said, they might not even be hit puberty yet, and they're already doing grown-up things and stuff. So that's a big stressor, and it's a cause for addiction for that parent and for that child with too much on them too early and stuff. It doesn't matter, girl or boy. And so I'm talking about the child, the teen, have to go out and possibly sell drugs so that they can make sure that they sisters and brothers eat because mom then checked out or dad then checked out or they both checked out, and stuff like that. That's where all of this comes from. And it's bad, but it's reality. It's not weird and stuff. It said the body often shows early warning signs, and common warning signs of addiction is mood swings, isolation. That person ain't acting funny. They're isolated because they don't know what to do with themselves. So they're thinking about what can I start doing to make me feel better. I'm unhappy with my life and everything. And that's where that comes in at and stuff. So isolation, neglected responsibilities like paying your bills, like washing clothes, or like cooking food and meals and stuff like that and things like that. You end up running into financial problems. You don't have enough money, not even to almost make ends meet and stuff like that. That's almost everybody and stuff still, but also it's not, and stuff. It's unusual. It's more overwhelming because it thrusts you into addiction and everything. And then there's physical health decline, just everything going bad, and stuff, hygiene, all of it, and stuff, weight gain or extreme weight loss, and stuff. And it has something to do with your mental illness, taking precedence over everything and stuff. And that's where that comes in at. So when your behavior changes before your words do, your body is telling the truth. When your behavior changes before your words do, your body is telling the truth. Just as simple as that and everything and stuff. So I'm just going to go ahead and go to prevention and your take-home message, and I'll be out of here. And that is prevention. Ways to reduce addiction risk. Not to say that you can't get addicted to something and everything and stuff, but ways to reduce it is educate yourself. Get on the podcast where they talking about addiction. Okay, it ain't you right now. But now you got this in your brain, in the back of your brain, in your Rolodex of your brain and stuff. You just got yourself educated on something and everything. It's maybe not you now. It could be you in the future, or it was you in the past, and stuff like that. But just knowing is more of the battle. That's half the battle and stuff. Mental health support. Don't be scared. It doesn't have to be just church. Like she think church gonna do that. No, I didn't say that. For me, yeah, maybe, stuff. But for you or anybody else and stuff, it's get some type of mental health, something, so that you know how to, um, so that you know how to develop the skills you need to keep you from getting addicted, or to keep you, to help you kick the habit. If you are, if you educated, you already know that this not gonna end well for me and stuff. Sonia said, not wanting to feel or deal with life. Absolute. That's the 100. That's the $1 million quote right there. Is not one to feel or deal with life. Meaning life is so damn hard. I'm tired of this. I can't do this no more. Then what happens if you can't do it? What about your kids? You already brought them into the world. What about what about your mother, your father, your sister, your uncle, your auntie, whatever and stuff, what about all these people that look up to you and stuff like that? You know, Sometimes you almost can't afford to, and everything, but everybody is not okay, even when they're laughing. I even said that on another podcast when I said everybody was asking, about our mother, being, in her situation and everything. And I was like, yep, I'm okay. Yeah, I'm okay. But you know what? The difference is I am also over your body's a snitch, believe it. So guess what I was getting? Headaches. And if I'm telling you, then guess what? Who I got to tell? I got to tell me too. So guess what? I had to take just a small low dose blood pressure pill. But I needed to take it because guess what? It just prolonged my life because I was not dealing with what I was supposed to deal with correctly. And you a nurse and you don't not, yes, we mess up too, because guess what? We human first, and then whatever our title is second, and stuff. So at the same time, I'm like, I'm okay. Yep, I wasn't okay. I was stressed out and everything else and stuff. So the moral of the story is sometimes people can read you, and if you got the gift to read, keep that gift and keep harnessing that gift, because you'll be able to catch somebody and say, yep, you're not okay. So what you gonna do about it, and stuff? You're gonna be able to do that, and not a mean way and stuff, but you're gonna be able to find out, because it's so many people one time in your life or not has had this situation where you felt like not wanting to feel or deal with life. Life is hard. Life be lifing, and stuff like that. You got to worry about so many different things. After a while, you break down like, can I have something good happen to me? And then when something good happens to you, sometimes it become a burden. And so, yeah, how do you deal with that? And how do you fix it? Yeah, it's crazy and stuff. So the moral of that is my take home message, you guys and stuff. I'm sorry, but anybody that just now coming on or whatever and stuff, this was a good one. This is worth listening to again and stuff. It'll be available probably about 3 to 5 minutes after I get off of the live and everything, where you can go to Facebook, and it's Charlene Nurse Allen. And then on YouTube, it's Medical Talk in Layman's Terms with Nurse Charlene. And you can watch the replay. And I'm telling you, it's something in there for everybody, even if you haven't gotten addicted yet. And even if you don't want to know if you are not and stuff, it's good to educate yourself, because they said that's one of the treatments and stuff. Let me see. What you said, stop buying drugs from your partner. Don't hold on. Don't hold on to how you feel. Do not feel ashamed to speak what's in your heart. It's okay to talk to a professional. Drinking or smoking weed is not going to fix the issue ever. And life needs you to feel so you can grow. I'll be darned. That's the national anthem. That's the national anthem. I like that. That good work, Sonia. She said that. She said, stop buying them drugs from your partner. Don't hold on to how you feel. Don't feel ashamed to speak what's on your heart. It's okay to talk to a professional. drinking or smoking weed is not going to fix the issue. It won't. It never has. And stuff, it might numb you temporarily, but then it come back tenfold on you and stuff. So it was it's not gonna fix the issue, and life needs you to feel so you can grow. Yeah, that's how you grow. That's how you develop that thick skin. That's how you develop that will to push on and stuff. And you'll find that, oh, I was right there, and dang, I messed that up and stuff. And then when you're able to see that and you still standing, it's a whole powerful thing when they tell you to know who the F you are. That you need to know who the hell you are, and stuff like that. That really means something and stuff. And it's serious and stuff. This is what I'm doing right now. This is what it's all about. Things like that and quotes like that. That's some real stuff. That's some real work being done and everything. So addiction is not about weakness. It is a complex medical and psychological condition. The most important truths are addiction can happen to anyone at any age. Well, almost any age. A baby can't do it and stuff. Oh, yes. And Sonia said, drinking bothers your depression. It absolutely does. Because once you come off of it, that stuff is still there, but it even hurts a little bit extra. A lot extra. So if it was already in pain and then you drank and it numbed it for a minute and stuff, once that wear off, guess what? That problem compounds. It doubles up on you. And then this little problem that you tried to avoid is now, boom, sitting there like, yep, I'm still here. You ready for me? Yeah, it taunts you and everything. So thank you for that. I appreciate it. So addiction can happen to anyone at any age. Early warning signs matter. It will show you that something is going down and stuff. Treatment works. There's actually treatment. And it actually works. And you can become a very healthy, productive citizen. All of us. Because I'm talking to you and talking to me, and everything. And recovery is possible. Recovery is possible. That means you can heal from this. It ain't something like, oh, I'm gone now. I'm going to die. I'm done. It's over. And so, no, you actually can rehabilitate and detox and all the other stuff and get counseling and everything and live a productive, healthy lifestyle and fix yourself. Addiction hides the problem, but the body always leaks the truth. Addiction hides the problem, but the body always leaks the truth. It's going to come out. It's going to snitch on you. It'll find a way. It's going to do something to you and everything. So then, in conclusion, addiction affects the mind, body, family, and community. Understanding addiction in simple terms help remove the stigma and encourages people to seek help. Let me say that little last part again. Understanding addiction in simple terms helps remove the stigma, the stereotype, what they say, and helps encourage people to seek help. Like you got hope. We got hope. I got hope and stuff. Recovery requires medical care, emotional support, education, the right education, and long-term commitment to the cause. You worth it. You worth it. Everybody is worth it. And when people listen to the warning signs from their bodies and they seek help early, lives can be saved and restored. And final quote, your body is the most honest witness you have. When it starts talking, it's time to listen. I am done, you guys. I want to say that one more time. Your body is the most honest witness you have. When it starts talking, it's time to listen. When your body starts doing things to you, you better listen to them symptoms, that nausea, that extra weight gain or that extra weight loss, your teeth falling out, uh you're dizzy all the time, you're irritable all the time, your mood is changing, you're neglecting something, you're not taking a bath or a shower and stuff and cleaning yourself up, you stop brushing your teeth, you stop doing your hair or getting shaves or the haircuts and whatever it is and stuff, that means something is wrong. When you start neglecting that, that means that you don't care about yourself anymore. Like, why are you doing that? And usually a substance is not going to help you get there no faster. You're not going to dress up and then go out there and look for your methamphetamine, crystal meth or something. You're not going to dress up so you can get litty drunk, or sometimes you do and stuff, but it's not cute, and stuff when you dress up, because if somebody took advantage of you and did things to you or even killed you while you're under the influence of something, and stuff, then what happens? Your family still love you. You're important. You matter. You here. You're a human. And there's never going to be another you. So at the end of the day, thank you all for coming on. Thank you for your beautiful participation. I love the comments and everything and stuff. You guys rock. I will be going off air. I don't know when I'm coming back on, but at least for maybe a week, maybe two Tuesdays. So this is my last one for now and stuff, and that's because I have to do some transitioning. Life be lifing, but it's a good thing. This is a good, healthy thing that's happening and everything. If I'm able to get on ahead of time, of course I'll advertise and stuff so that you guys know to get on with me and stuff. But for right now and stuff, look forward to probably next Tuesday. There's going to be no Charlene on and stuff, but I will start back up in good fashion, hitting them hot subjects, and stuff and everything, because I found out that I make a difference and stuff. So Auntie Josie, I don't know if you're still on and stuff like that, but thank you and stuff. And we've been going back and forth about some situations that Auntie Josie is dealing with. She's on as Josephine Collier and stuff. Thank you, Auntie, and stuff. And I appreciate you coming to me and stuff, because it's not just a little game that I'm getting on here and try to be cute and stuff and talk about some medical stuff. It's actually helping people with their family and their health and everything, and expressing certain things that they need to know to tell the doctors and stuff like that. I do give advice like that. And it's usually something right on point that I would do for myself, or I would do for my, daughter or my son or something like that and stuff. So this is very good. Also, Miss Sandra on and stuff, and coming on and stuff and talking about her truths and everything and stuff like that. And all my family members and stuff, they love me. I love them. I appreciate them and stuff. And these kind of talks and everything really pounds that in, and stuff. And Auntie Josie said, good night, everyone. Thank you again for the information. Ask always. Yes. And you said, I need to speak to you with you again. Absolutely, Auntie, and stuff. And thank you all for coming on. Let's talk about medication soon. Absolutely. That's Sonia, my sister. She said, let's talk about medication soon. Absolutely, and stuff. And I did want to talk to you about something that we started up on and everything and stuff, that it worked really well and everything and stuff. So I'll be talking to you soon also. And yes, I thank you guys and stuff. And just remember the thought behind why I'm getting on and stuff. And that's the biggest deal and stuff. I'm not getting on for fad or fashion and stuff, and everything. Anybody could do that. I'm getting on to address the real deal that we're dealing with, and that everybody is a human being, and that you got to give yourself some type of grace or you'll fall for everything. But thank you guys. Love you all and stuff. Y'all take care and stuff until we meet up again and stuff. What is that? Okay. But until we meet up again, my little mouse then went out. Oh, now I didn't. Okay, so y'all take care. Y'all take care and stuff. I can't make this up and stuff until I see you again and stuff. And I'll keep you posted on Facebook and everything and tag you guys to the flyer and everything. So when I start back up, we'll just keep on business as usual. Take care, everybody. Sonia said peace and blessings to you and yours and stuff. Thank you and stuff. Yes. Love you all. Take care.